So, Madam Speaker, what can I say about the biggest spending budget of all time, the fall economic statement from this 2004, a budget that will show a $6.6 billion deficit. In fact, Madam Speaker, under this Conservative government, Ontario has amassed $106 billion in new debt. That's over 25% of Ontario's total debt of $408 billion. So, Madam Speaker, in 6.5 years, this so-called Conservative government has amassed 25% of Ontario's debt over 157 years since Confederation. Madam Speaker, with a population of roughly 16 million people, that means every child born in Ontario will inherit about $25,000 in government debt. From the moment they're born, Madam Speaker, that's the price of a small car. That used to be a down payment on a home in Ontario. That certainly used to be enough to pay for university in Ontario or college, Madam Speaker, and that is the debt that every child in Ontario will inherit. And so the question has to be, Madam Speaker, what are we getting for all of this massive record-setting debt? The highest sub-sovereign debt in the world. Well, Madam Speaker, that highest sub-sovereign debt in the world is buying 2.5 million Ontarians without a family doctor. That record spending is set to see that number exceed 4 million Ontarians without a family doctor by 2026. That will mean 1 in 4 Ontarians won't have access to a family doctor. And, Madam Speaker, even those Ontarians who are lucky enough to have a doctor may have to drive excessive distances and times to see them. There are 650,000 people that live more than 50 kilometers away from their family doctor. 150,000 Ontarians live 200 kilometers away from their family doctor. So the highest sub-sovereign debt in the world is buying millions of Ontarians with no family doctor at all, and hundreds of thousands of our neighbours and friends who have to drive hours just to see one. But the crisis in healthcare doesn't end there, not by a long shot. There are 200,000 people, 200,000 of our neighbours, of our friends, of our family, waiting for diagnostic or surgical procedures. For the record spending, for the massive debt, surgical wait times under this Conservative government have gone up by 48%. On any given day, Madam Speaker, 2,000 people are getting care in hospital hallways. Now, I remember in 2018, the Premier came to Orleans to kick off the province-wide election, and he's promised to end hallway health care. But 6 years later, Madam Speaker, after record spending, after massive new debt, over $100 billion in new debt under this government, hallway health care is worse than before they were elected. So, Madam Speaker, this hallway health care, these lengthy wait times, this crisis in the system has resulted in over $2 billion in lost economic activity. This is lost wages. This is lost productivity. This is lost spending power. All of that, Madam Speaker, because the record spending, the $100 billion in new debt, the largest sub-sovereign debt in the world, isn't focused on delivering the best health care for Ontarians. But, Madam Speaker, it gets worse. There is something worse than simply losing $2 billion in economic activity. There is something worse than 200,000 people waiting for surgery. There is even something worse than 2.5 million people without a family doctor. Madam Speaker, the crisis in healthcare after all of this record spending and debt has led to 11,000 Ontarians, 11,000 of our neighbours, of our friends, of our family, our constituents, dying while waiting on a wait list for a diagnostic service or a surgery. That, Madam Speaker, is a crisis that could have been avoided. A crisis that could have been avoided if spending on health care was focused on those areas where it's needed most. Now, Madam Speaker, under this government, Ontario has seen enormous erosion in our economic activity. We have the highest small business taxes in the country. There are 50,000 fewer jobs in Ontario's labour market. There are 130,000 more people in Ontario unemployed than in 2018. And Ontario lost 36,000 construction jobs and 8,000 manufacturing jobs just in the last 12 months, Madam Speaker. And what have we seen from this government? We've seen them vote against cutting the HST off of home heating to provide families relief. We've seen them vote against cutting taxes or providing parents with a tax credit for the sports and extracurricular activities they put their children in. And we've seen a government be against the small business tax credit that my colleague here in the legislature has proposed. And so while the government is amassing record deficits, enormous spending, has created a crisis in health care, families across the province are suffering in an affordability crisis, the likes of which we haven't seen in a generation. Thank you, Madam Speaker.
Thank you, Speaker. My question for the member from Orleans. You were right. This government has increased the net debt by $100 billion. They actually have a per capita loan of $26,000. You said 24, but it's even higher than that, $26,600 for every man, woman, and child. So clearly, this government is spending big. They're spending $100 billion on a fantasy tunnel. They've spent almost $1 billion to support a luxury spa at Ontario Place. And now they're going to spend $3 billion to give checks for $200 that most people understand is nothing but an election buy-off. We just finished debate on Homes Ontario, the bill that we proposed.
Question.
I noticed you didn't participate in the debate or vote on it. Do you not think it's important that we support and spend money on homes in this province, not just on these giveaways for this government?
Thank you. Response.
Thank you very much, Madam Speaker. I'm always happy to talk about the record, irresponsible spending and massive debts of this so-called Conservative government, who has driven Ontario's debt up by more than 25% in only 6.5 years. Their spending priorities are not the priorities that I would have. They're not investing in the kinds of healthcare services, education services, and infrastructure services that I would like to see in Orleans or in Ottawa or truly across the province. In fact, Madam Speaker, I believe there are something like 6 pages of transit investments in this fall economic statement, and not a single mention of the City of Ottawa in 6 pages of transit investments in the fall economic statement. So yes, I believe there is a role for government to play in encouraging the creation of new homes and investing in housing. Unfortunately, Madam Speaker, I personally didn't have the money available to pay to access the NDP plan on their website, which is one of the reasons why I abstained from voting on that today.